This is my sister. This is my son. They both have intellectual and developmental disabilities. Sometimes the solution to a complex problem is simple. It's learning to get comfortable with the uncomfortable. In healthcare, that discomfort often comes from a lack of knowledge, uncertainty in communication, or fear of making a mistake. But what if the key to improving health outcomes for individuals with IDD was as simple as education and training? This presentation will explore exactly that: how equipping healthcare professionals with the right knowledge can lead to better, more equitable care for this population. This is a presentation I originally gave at the Advancing Healthcare Innovation Summit, AHIS, in Cincinnati in 2022. The insights and strategies I shared then are just as relevant today because the need for better healthcare outcomes in the IDD community hasn't changed. If anything, the urgency has only grown. Let's dive in.
IDD is a term that describes situations where intellectual disability and other disabilities are combined. These differences are typically present at birth and uniquely affect a person's development and trajectory of physical, intellectual, and/or emotional development progress. Many people with IDD experience degenerative diseases which lead to frequent healthcare needs and deteriorating communication skills. 17% of our population have some form of IDD. Healthcare barriers in this population have been vastly studied and correlate with the premature mortality rates that this population faces. Those with IDD are often excluded from research opportunities and health surveillance collection. Due to the lack of available and quality data, there is a lack of evidence-based practices in this population. Evidence-based practices represent the structural model that every organization is striving to embody right now. There is a lack of health outcome studies in this population as well, due to the IDD population varying in literacy, competency, and ability. The health outcomes are not a reliable data collection method for these patients.
Let me give you a personal example of how these systemic gaps directly impact real people. My sister, who has profound IDD, has been waiting nearly 4 years across 3 different hospitals just to get routine dental work done under anesthesia. Despite my mother reaching out to multiple advocates and hospital systems, each facility either denied her care, delayed the process, or lacked the proper accommodations for patients like her. Now, after years of waiting, she's finally receiving treatment at the only facility in Kentucky that offers it. This isn't an isolated case. This is a nationwide failure in our healthcare system.
Stigma is a fundamental cause of health inequality, influencing physical and mental health, inhibiting or disrupting multiple resources, and enabling the reproduction of health inequality among social disadvantaged populations, such as the IDD population. Most patients with IDD have poor communication and social skills, most commonly having their care provider or parent be their advocate for healthcare needs. This study shown here included 13 interviews with caregivers of patients with severe or profound IDD. Upfront knowledge of the physician and their ability to interact comfortably with the patient and caregiver was found to employ a feeling of trust and safety in the physician's ability to treat the patient, leading to an ongoing relationship. The study also highlighted the assumption of physician authority or physician-centered care. When a provider's attitude took this trajectory, it led to caregivers feeling their patients were disrespected and dismissed, leading to a feeling of helplessness and dependency on a medical system with minimal options for the care of IDD patients. Caregivers used words such as fought and begging to describe the extreme measures they had to use to ensure appropriate health care and maximize the quality of life for their family members or clients. As a sibling of somebody with profound IDD, This quote rings true for my family as well. This is a reality for families and caregivers that is an extreme injustice, but it happens far too often. A thorough literature review was conducted to explore studies and training regarding this population to identify techniques that may reduce stigma. While there were no training models found to focus on the reduction of stigma in those with IDD, teaching a social model approach to disability was found to positively influence providers' views on those with IDD. Additionally, comfort levels were shown to significantly increase in healthcare professionals after IDD training. States are now receiving grants to implement training programs as well as universities. Training programs are available for purchase from various organizations, but there are no standardized trainings or methods that exist currently. A recent systematic review conducted stated there remains a need for researchers and practitioners to prioritize and evaluate interventions to reduce stigma among the IDD population. These findings led to the proposed research question and hypothesis of this study. Due to the variety of literature and studies assessed during the literature review, a specific population of healthcare professionals was chosen to evaluate. Emergency room personnel will encounter a person with IDD at a point in time when knowledge and competency are critical for patient outcomes. This study hypothesizes that there is a direct relationship between healthcare professional stigma of disabilities and health outcomes in patients with IDD. The use of anti-stigma IDD training in healthcare professionals in the ER will decrease stigma. Lastly, the reduction of ER healthcare professionals will result in increased health outcomes. Reducing stigma within our healthcare system will enable providers to be comfortable and competent. It will improve the quality of care. It will enable a patient-centered care approach. Knowledge is critical in healthcare. We must advocate for standardizing training and all healthcare professionals regarding this population. Movements currently to standardize approaches to training are costly and not readily available for every facility. In conclusion, there is a need for systemic change in how our healthcare system trains and educates its physicians and healthcare personnel, as well as standardized health outcomes specific to IDD patients. Additionally, further research into direct service support agencies of those with IDD is needed to teach and implement how to use and analyze their data to drive community support improvements.
My mom and I have often debated whether keeping our struggles with raising children with developmental disabilities private is doing more harm than good. We don't publicly share the challenges, not because they don't exist, but because we don't want it to seem like we're complaining. But the truth is, our healthcare system is still failing this population. We need to do better as healthcare providers, as a society, and as a country. The best way I know to contribute is by sharing my passion and advocating for greater awareness. Maybe progress has been made in the 3 years since I first presented this research. If so, I want to know. Please, if things have improved, correct me. Because at the end of the day, it's not about being right, it's about making things better. If this message resonates with you, please help spread awareness by liking this video, leaving a comment, and subscribing to the channel. Together, we can push for a healthcare system that works for everyone.